Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Novavax from Roots Community Health Center, reporting for the week of October 3rd, 2022. Today, I'm going to provide updates on COVID-19, monkeypox, long COVID, Enterovirus D68, and also touch on boosters and Novavax. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Here in Alameda County, cases continue to kind of slowly come down. We were at 2758 over 14 days last time, and now down to 2238. So still going in the right direction. Unfortunately, in terms of positivity rate, we've come up just a bit from 4.5% positive to 5% positive. Hard to say whether that is just a function of who's getting tested, how many people are getting tested, or whether we really are going to be going back into an increase, but I think that that remains to be seen. Good news in terms of hospitalizations. So we are continuing to be in the double digits, looking forward to getting down even further than this. Last week, we were at 80 folks in the hospital with COVID, 5 of them in the ICU. Now we're at 72 in the hospital, 8 in the ICU. And wanted to just bring up the COVID deaths in Alameda County overall. We've had 2,027 COVID deaths in Alameda County during this pandemic thus far, and wanted to share a breakdown in the age groups because for quite some time we didn't have any deaths in the younger age group. But unfortunately, we have lost 32 people under the age of 18 to SARS-CoV-2 and another 32 people in the 31 to 40 age group. And then you can see the other age groups there. Of course, over 70 is where we've had the majority of deaths, but unfortunately, this did not spare our young people, and we do have deaths in those, even the youngest age group there, under 18 years of age. And daily new confirmed deaths in the United States are very stubbornly still elevated. So this is really not reassuring at all. This was 408 deaths per day average last week when I reported, and now 437 average deaths per day. So this is really just hovering at a bad place here. And so this is not something that I think we can accept. This can't be the new normal. This is, again, a 9/11's worth of people, more than that in a week. Over 150,000 people per year. This is just still, at a very devastating rate. So it's clear that we need to do better on several fronts, both preventing catching COVID in the first place, making sure that even if you do, you're fully protected with vaccination and booster, and also that if you're eligible for treatment, you get it. And so we'll touch on some of that in a moment. But I wanted to point out also our wastewater because good news on a couple of fronts here. One is that it is continuing to come down, which is good. But I think what I was most excited about is that the data is pretty updated. So it was about 2 weeks lagging behind previously. And we see now that we've got some data that's as recent as a couple of days ago. So that is good news. I'm really hopeful that this will become a better real-time tool, kind of how we had envisioned it in the first place. So we'll just continue to keep an eye on it. And certainly if it starts to go back up, we'll report back out on that. In terms of our variant proportions, we keep an eye on this because, of course, what we're concerned about is that we will get variants that are evading our prior immunity or some of our treatments. And we've already got a couple on the scene here that are ones to watch that we're just a little bit concerned about. Right now, we're still predominantly with the BA.5. It's still over 80%, and that's good news, simply because that is the one that we have a new booster targeted against, and it's also targeted against many of its subvariant. One of the ones we're kind of keeping an eye on right now is the BA.2.75. It's in maroon on the variant tracker. It's still only about 1.5%. But this one is looking to be a little bit, it's kind of getting around our antibodies that we've had before. Same thing with the BA.4.6, which kind of keeps on creeping up. It was 11.9% last week. Now it's at 12.8%. And so we're kind of watching as some other branching off is happening. We've got some other new variants that are being identified, and there are, a couple of them that we're going to want to continue to watch, because they may even get around some of our monoclonal antibody treatment and prevention as well. But right now, so far, our tools are holding up, but we know that with more transmission is more variants, and that's more opportunities to get around our tools. So we're definitely, more so concerned about the months to come in terms of, having more of a winter surge, or having, something like what happened last year where we had a new variant just pop up. So hoping that our surveillance is a little bit more real time this year, this time around, and that we will kind of be aware if and when there's one that's coming that we need to be more concerned about. And I think it's important for all of us to take a look at that, because it might determine how well protected we feel that we are by either, the prevention medication, Evusheld, or how protected we might feel by our vaccines. So once again, more transmission is more opportunity for more variants and to get around the tools that we have. So far, everything seems to be holding up well. And hopefully this year, we're a little bit more timely with some of our surveillance and sequencing, and hopefully we'll have enough lead time to address these things. The other good news is that the Paxlovid, which is our first line treatment, is holding up against all the variants so far, and that makes sense based on how it works. And so that is a really key tool as we continue to move forward in this pandemic. And turning for a moment to monkeypox, or MPX, cases kind of keep ticking up. We're somewhere around 200 new cases per day here in the United States. Worldwide, we were at about 65,900 cases last week. We're now over 68,000. And we are also kind of creeping up here in California. We've got a little more than 5,000 cases total. You can kind of see we've plotted it out on this graph here. So it's slowed down a little. It's not quite as steep, but it is continuing to increase. So this is something that we're going to want to continue to be vigilant around, because we know that this is actually reflecting under testing. We've certainly heard about folks who kind of get a rash and just try to tough it out at home. We've heard also people having trouble being able to get the testing that they need. And so I think it's just important that we get tested. If you get a rash, don't just tough it out at home. Let's get it tested so that we can make sure we're not spreading it to others. And also, in case if you need treatment, if we need to vaccinate contacts, we can get that done. And so I wanted to share this report out of the Morbidity and Mortality Weekly Report from September 19th. And this is describing a case of an infant, a child under the age of 2 months, who was admitted to a hospital in Florida with a rash and skin infection. And this basically is the youngest patient with a confirmed MPX infection in Florida, certainly. And overall, there have only been 27 confirmed cases of MPX in pediatric patients 0 to 15. And so I think the reassuring news here is that the baby did recover completely. This was contracted through close contact with a caregiver, and that caregiver, was engaged in some activities that put them at higher risk, and they were positive for MPX. They were able to vaccinate all of the other household contacts. And as I said, the child recovered. So that is good news, because I think we were very concerned with this form of MPX, what will happen when it gets into children and pregnant women and so on. So we don't have a whole lot of experience with it yet, but according to this one case study, although it was severe enough for the child to have to be admitted, they did recover well, and so that's the good news there. Another thing that's been going on with our little ones is that we do have an enterovirus called Enterovirus D68 that has been circulating around. This is not a new virus. We've had this one before, but we've had it at very low levels for quite a while. And right now, surveillance data and a lot of what we're hearing from the hospitals is that there's been an increase in this respiratory virus that is taking little ones to the emergency room and even being admitted to the hospital. And these are mostly children and adolescents. And they are having sort of a respiratory illness as well as kind of asthma-like symptoms, so wheezing and so on. And so the CDC put out health alert to let providers know about this, because this is something that we have to specifically test for if we suspect it and if we need to know. And I think the biggest thing to kind of know about it, and there was a write-up that I've linked in the post, also in the MMWR, the Morbidity and Mortality Weekly Report, just this September 27th, talking about this increase in respiratory illness and what we should know about it. The main thing I think that is a little concerning about it is that it can rarely cause what's called acute flaccid myelitis. And so, like I said, it presents like a respiratory illness, but it can then cause this weakness in the limbs. And so if a child is, not feeling good, coughing and so on, and has weakness in the limbs, is something we want to kind of really be suspicious about and make sure that we are getting medical attention and that they're testing for it. Also, this is sometimes associated with some shortness of breath, and as I said, some wheezing. And so that is typically what's taking these young people to the emergency room, is the shortness of breath and difficulty breathing. And so, of course, we always want to be very vigilant, especially in children who already have asthma. So a couple of take-home things here. One is, I think the good news is that for protecting ourselves against COVID, then we're protecting ourselves against any other respiratory viruses, including this EVD68. And so we're going to be wearing a mask, washing your hands, avoiding touching your eyes and nose and face, and obviously avoiding close contact with anyone who's sick. And if your child is sick, please, please, please keep them home. This is not just about COVID. So one thing I've been hearing a lot lately is, well, I don't feel very well, I'm coughing, but it's not COVID. And it's like, no, I don't want we don't want to be hanging out. We don't want to be gathering. We don't want to be going to school. We don't want to be going to work if you're sick, even if it's not COVID. And so we don't want to just be spreading around respiratory illnesses, period, regardless of which one it is. The other thing is that if you have asthma or your child has asthma, let's please make sure that they have their inhalers on hand, that they've got an up-to-date asthma action plan, because we want to make sure that we're prepared in case if they do get a viral illness. Sometimes that can really exacerbate the asthma. And so we want to make sure that we're up to date with the asthma action plan and any kind of inhalers or any other medications for asthma. And of course, we need to make sure we're up to date with all recommended vaccines. And this includes the flu vaccines, includes the COVID vaccine. There's not a vaccine for the enterovirus D68. We don't have a vaccine for it. But I wanted to bring up the fact and the health advisory that is also linked in the post about this enterovirus is that right now, when we've got this concern around polio, which is a different enterovirus. Enterovirus D68 is a non-polio enterovirus. However, like I mentioned, it can cause this weakness in the legs. And so it is presenting a little bit like how polio could present. So key take home there is get vaccinated for polio. If you are not up to date, if you're not sure, go ahead and get a booster. Children should be up to date with their polio vaccine. We don't need any extra confusion going on right now about paralysis. And so I think, this isn't, I don't think anything to get too overly concerned about, but just know that, we are heading into flu season. We are already getting into some respiratory viruses. And that includes this enterovirus D68, which was kind of at low levels before, but we're just seeing, a substantial uptick of it right now at this time. And so we just want to be on the alert for it. And shortness of breath, wheezing, coughing in your child, go ahead and call your doctor, see if it's something that warrants coming in and being seen. But certainly wheezing, shortness of breath, those are reasons to get checked out. And so now I want to talk a little bit about the boosters, because we're still just getting a lot of questions about, should I get it? Should I not get it? And wanted to bring forward some data that might help in kind of shining a light on what is still going on with SARS-CoV-2. I mentioned over 400 deaths per day still. And we know that the risk of this happening is so much higher in people who are unvaccinated. But we're also seeing a significant difference in people who are fully boosted compared to those who are not. And that's especially true when we look in people 50 and up. So if you are 50 and up and you're unvaccinated, your risk of dying of COVID-19 is 12 times higher than people who were vaccinated and have had 2 booster shots. So that's pretty significant. So you could see from that getting a booster, if you're 50 and up, is well advised. And among people who were 50 and up, people who were vaccinated with a primary series and 1 booster actually had double the risk of dying compared to people who had that second booster. So once again, it looks like getting that additional booster is significantly cutting the risk, like in half, of dying from SARS-CoV-2. Now, if you are healthy and you're under 50, then your risk of actually dying from SARS-CoV-2 is definitely getting smaller, particularly if you are vaccinated and boosted, and if you're eligible for treatment, you get treated. And so we really do have a lot of different layers of protection to protect us. But it does look increasingly like that second booster is going to be an especially important extra layer, especially if you're 50 and up. But of course, we know it is recommended for everybody 12 and up to get the Omicron booster. Why? Because it has the strains of SARS-CoV-2 that are circulating right now. And so there's been a lot of debate, well, is it really that much better than the other booster? And I think at this point, I kind of think it's a moot point, because right now what's available for the booster is the one that's more finely tuned to the BA.5 that we're mostly dealing with now. Remember, I mentioned it's over 80%. And some of the new other variants that we're seeing are kind of, deriving from that BA.5. It's also got the original in there. And so you've got both in there. So I think that there's really not a downside that we know of on getting this most recent booster. And for most people, the last shots you got, the protection might have worn off significantly. And so at this point, it is definitely recommended that you get that booster. And I would say, thinking about getting it fairly soon. We're starting to hear a little uptick of people who are like, I avoided it all this time. And now I got it, and it's mostly seeming to be people who are overdue for the booster, and we're kind of regretting not having just gotten it. And when everyone is seeming to be kind of letting down their guard out there, even if you're being vigilant, others around you may not be. And so these are all good reasons to be getting that that second booster. And I'm not going to go over in detail today about the impact of vaccination on long COVID, but I will just say that there has been more emerging evidence that getting vaccinated and boosted is providing some reduction of getting long COVID. Is it completely eliminating it? No, unfortunately, it's not. But it is reducing it. And I'll go over in some more detail some of the evidence that we have around that. But at this point, there just really isn't much downside. I would say we're going to be definitely wanting to get that booster. If you haven't had a shot in the last 3 months, if you haven't had COVID in the last 3 months, go ahead and get that booster. Now's a good time because we want you to be well protected for when we go into our winter surge, which we fully anticipate we'll have one. And so it's good to get protected ahead of time. And also you may be planning to be traveling over the holidays and so forth. So it's good to get that booster also, a few weeks before you are traveling so that you will have maximum protection at the time that you're traveling around, and hopefully you will not be catching it yourself or, transmitting it around to others. And so on long COVID, there's a lot of information that's been coming out about long COVID. All those billions of dollars in research do seem to be somewhat paying off. I wanted to share, this is kind of a big, complicated infographic, but I linked it in the post. For those who are interested, I think this is a really useful infographic. This could be for you as an individual who's, has long COVID or knows someone who does. This is also really, it's actually meant for healthcare providers to kind of give a little bit of a guide. And I think that the information on it is useful. The parts that I kind of wanted to point out are the different investigations and blood tests that should be being done. And so this is something that, healthcare providers should know about, but I think it's also good for patients to be informed. And so you can always share this information with your doctor. We've been hearing definitely that, not all doctors are too up on long COVID, or may not be sometimes relating the symptoms to even asking about a history of COVID. And we've also heard, some patients feeling like, doctors just aren't necessarily, understanding that this is a real phenomenon, but it certainly is. And I've gone over it in a prior briefing about kind of the evidence that we have to date about long COVID and some of the theories about what's causing it. But the good thing is that we're beyond theories and we're a little bit into what can we do about it. And so there is a list of some warning signs when we should be worried and maybe go ahead and intervene, and also how we should be kind of working this up. And so you can see here in the middle is where the things that we should be worried about, that have to do with maybe the heart or neurological system, and so on. Those are things we should be concerned about. Also what to test, when we should refer, and so on. So I thought this was handy and maybe helpful. So go ahead and check it out if you're interested. And just a reminder about Novavax. Remember that this is a non-mRNA protein subunit vaccine. Please tell all your friends who didn't want the mRNA vaccine that they can get the Novavax. It's 2 doses, 3 to 8 weeks apart. We are keeping an eye out because we're hearing that they are going to be coming out with a recommendation around a booster for the Novavax. So this may be coming in the next couple of weeks. The other thing that we're keeping an eye out for right now is that we're hearing that they are going to approve a bivalent booster for the under 12s. We've already been able to pre-order them. So it looks like that is something that's going to be on the way. So right now, booster for everyone 12 and up who hasn't had a vaccine in the last couple of months or had COVID in the last couple of months. But hopefully soon we'll be hearing about it for the under 12 age group. And so we are still going to be needing to reduce transmission and death. So we really want to, I'm seeing just a ton of letting the guards down and kind of leaving oneself open. And I'm finding that when I talk with people about it, that people are not really realizing that it still really is circulating around. And you still definitely can catch it. And there are still things you can really do to not catch it. So I think it's just good to kind of remind one another. I know it's getting sometimes harder and harder to have those conversations, but definitely you certainly have every right to protect yourself in the best way that you know how, and to not put yourself into situations that may be dangerous, and advocate for yourself. Ask pertinent questions. Don't feel shy. Don't feel like you're the only one, and so on. It is completely up to you to be able to protect yourself. And the other thing I would just say is, please let's not forget about treatment. I'm still just hearing too many people that are not really sure about whether they're going to get treated or not. So I try to ask this to everyone. If you catch it, are you going to take Paxlovid? I don't know. So we should know. You should know. You should definitely know if you're going to be traveling abroad. We've definitely had people ask their doctor, then they get a prescription and take it with them, because the last thing you want is to be in another country trying to figure out how to get prescribed Paxlovid. So all of our doctors should be comfortable prescribing it by now. If they're wanting to be extra cautious because of maybe an underlying condition you have, they may want to run blood tests ahead of time. That is fine. I think just get all your ducks in a row, so that you make sure, because we don't know what the winter is going to hold. It is very possible, like so many of the surges that we've had, every single surge we've had has had its own little surprise. And different parts of the system have gotten a little overwhelmed with each surge, and it hasn't been the same, and it hasn't been predictable. And so I think the best advice I can give is do the planning that you are able to do, so that we can stay ready in case something unexpected happens. And the planning you can do now is know where you can get tested. If you start to get symptoms, get tested right away. If you're someone who's at higher risk, and you're not able to, just isolate, then we really, really want you to get that PCR right away, because we're much more likely to detect it nice and early, and then be able to get you started on treatment and make sure that you are properly isolating away from others. We're going to try our best to prevent spread within the household. I've done a whole briefing on how you can do that with HEPA filters and different tips like that. But right now, by and large, the most transmission is going to be happening within the household for obvious reasons. And so we want to really stay vigilant, because there's really no reason why the whole entire household has to get it just because one person does. I know it's easier said than done, but a big way that we do that is actually using the PCR test, so that you can detect it sooner, because we know that some folks are, testing negative on the antigen for a few days, and that could have been time that we could have been isolating and keeping it from spreading around the house even further. So we're going to want to make sure to get fully vaccinated and boosted. If you're immunocompromised, on steroids, on immunosuppressive medication, you may be a good candidate for Evusheld. Please talk to your doctor about it. Right now, it is giving about 6 months of protection, at least against the variants we're currently contending with. And so it is definitely something to consider. And also, if you were unable to get vaccinated, Evusheld may be good for you, or maybe you want to get the Novavax. So please look into that. And if you are unvaccinated, or you are at otherwise higher risk of progressing to severe illness, absolutely ask about Paxlovid treatment as well. If you catch COVID, what are you going to do? And is your provider ready to prescribe it for you? And if you don't have a primary care provider, please get one. Make sure you know how to reach them before you need treatment. And of course, we're going to maintain a balanced diet, going to get some good exercise, manage your stress levels, consider a multivitamin supplement with additional vitamin D, and get a good night's sleep. Next week is a short week, so we will see you the following week on the 18th at 10 a.m. Look forward to seeing you then.